Dandruff is a common skin condition that causes white or grey flakes of skin to appear on the scalp and in the hair. In this week's What's Up Doc, we'll learn more about prevention and cure of this type of skin problem.
Dandruff is basically, we can define it as dead cells, and all of us can get dandruff. Similar to the skin, when you get a little bit of dryness on the skin, you may see a little bit of flakes. Now, when dandruff is over than normal, to the point where you can see the dandruff in your shirt, that's probably can be related to two important conditions, either what we call it seborrheic dermatitis or psoriasis. Or sometimes we can see it even in newly born, known as cradle cap, when it is really excessive. So not all dandruffs are necessarily can be a disease. Some of them are normal physiological process where the cells of the scalp will be almost like dead, and you can see it as a flakes. So when you have a simple dandruff that can be controlled with normal anti-dandruff shampoos, that's not an issue. But when you have excessive dandruff to the point where you can get itching and can redness, and also you can see it on your eyebrows, inside the ears, behind the ears, this is most likely a condition that we call it seborrheic dermatitis, and can affect usually a newly born, but fortunately a newly born is self-resolving, and by age of 6 months or 7 months usually it will disappear. However, when it appears in adults, it tends to be a little bit stubborn, and interestingly it has been linked with the stress. The more stressful that the person, definitely the intensity of this seborrheic dermatitis will be more. So controlling this condition usually by proper anti-dandruff or antifungal shampoos, and sometimes we add also topical steroid lotion to control the condition. This is why we always joke with our patients, tell them take it easy if you have really dandruff, because no doubt stress or anxiety can increase this condition. Now, another important factor or cause of dandruff, especially when it is very thick and more into the hairline, is what we call psoriasis. Now, psoriasis, we have different aspects of psoriasis. The commonest one that we see it in elbows and knees, but there is a condition that what we call it scalp psoriasis. That what characterizes the flakes or dandruff on it as being very thick. And usually this condition is controlled by a more stronger shampoo that contain tar, for example, or contain salicylic acid that will peel off the flakes, so it will be easier for penetration. Of course, dandruff, when it is in female, it's more of, let's say, embarrassing, especially most of our people when they are wearing abaya or shela, dark, and the dandruff will show, so that can be really embarrassing to lots of people. And we tell now our patients, we have lots of good treatments that can control this condition.